Cervical changes during labor. When we think of being in labor and what needs to happen in order to have your baby, what most often comes to mind is cervical dilation. Everything seems to be measured by that. How far along you are, and then once you hit the big 10, then you're ready to have your baby. It's pretty much the only thing that happens to your cervix, right? Wrong. In fact, there are 4 things that occur to your cervix during labor in order to prepare and open itself to have the baby. These 4 things, ripening, effacement, position, and dilation, play an interconnecting role, and without all of them taking place, you wouldn't be able to deliver. Let's take some time to go through these 4 changes and learn about exactly what's happening to your body and your cervix during labor. Dilation. Since dilation is what we know best, let's talk about this first. Dilation is the measure of how open your cervix is. It's measured in centimeters, and physicians know it's go time when you've hit 10. For reference, 10 centimeters is about the size of a grapefruit. Physicians determine how dilated you are by using their fingers. So when they give you a vaginal exam, what they do is they're trying to open their fingers as wide as possible, and they know in their own mind exactly how dilated you are based on how open their fingers are able to get. Next is ripening, and so this is the softening of your cervix. So during pregnancy, your cervix is about the same consistency and firmness as the tip of your nose. Throughout labor, that's going to get softer until it's a very soft, almost mushy-like consistency, very similar or even softer to that of your lips. Another thing that occurs is what's called effacement, or the thinning of your cervix. And so most women's cervixes are approximately 4 to 5 centimeters thick, and that's going to get down to 0. So when your provider measures and tells you that you are 50% effaced, if you have a 4 centimeter cervix, then that means you're down to 2 centimeters. Lastly is cervical position. So for women during pregnancy and prior to pregnancy, their cervix is going to be facing up and towards the back, which is called the posterior position. During labor, we're going to want that to shift forward into what's called excuse me, the midline or anterior position. So if it's facing back, your cervix is then going to shift forward into an anterior position. It's important to note with all of these things that they're not working independently of each other. It's not that first you're dilated, then you're softened, then you're effaced. They are all interconnected. So you can be 3 centimeters dilated, 80% effaced with a posterior cervix, or you can be 100% effaced and 1 centimeter dilated. So they all work together. They're all happening at the same time, and ultimately you need to have a soft cervix, be 100% effaced, 10 centimeters dilated, and with an anterior cervix in order to have your baby.